Welcome to Working Smarter. I'm Wendy Rubis, General Counsel of Village MD, and I'm so excited about our podcast today. We're joined by a very special guest, Todd Park. I'm sure you've heard of Todd, but in case you haven't, he's one of the co-founders of Athenahealth back in 1997. He also served as part of the Obama administration as Chief Technology Officer for DHHS, and really was a leader of innovation and bringing forward a lot of the things that, are really in motion at this point with regard to data coming out of the administration. At present, he's the co-founder and executive chairman for Devoted Health, which is a healthcare startup that's transforming insurance on behalf of their beneficiaries, in particular in Medicare Advantage. Todd's career is so inspiring, and the work that he's doing in particular with healthcare right now is very aligned with what we're doing at Village MD, and he's a fantastic partner along with Devoted to Village MD. And so we're so thrilled to have him, and I hope you'll tune in for this conversation. Hi, welcome to Working Smarter.
Working Smarter.
Working Smarter.
Working Smarter.
I've been all around Village MD.
From the fine city of Houston to New Hampshire and everywhere in between.
I've seen the great work our people are doing. It's such an incredible,
exciting, fantastic time to be at Village MD.
We're so pleased to welcome Todd Park. Todd, how are you?
I'm doing very well. How are you?
Doing great. It's such a pleasure to have you here on Working Smarter. We're just so happy to have you. I think most of our listeners know about you and have followed some of the great things that you've done, but tell us a little bit about Devoted Health and how things are going.
I'd be delighted to. And thank you so much for welcoming me here today. I'm a huge super fan of Village MD, and it's great to be here with you all on this podcast. Devoted is a company that my brother Ed Park and I, and now 450 of our close friends, are building. The mission of Devoted is to dramatically improve healthcare for seniors by caring for everyone like they're literally our own family. And we seek to do that by helping seniors get the right care, including non-clinical support, in the right place at the right time. And to do that, we have built a next generation Medicare Advantage plan that is passionately, maniacally, intensely focused on working with the best primary care physicians in the world, like those at Village MD, and collaborating with them to get to everyone the kind of care that you'd want for mom and dad, and supporting that care with advanced technology that we built, and world-class customer service and care service capabilities, all in service to care for everyone like family.
Wow. I mean, these are big goals, Todd. It reminds me of talking to Tim. I mean, these are huge, enormous things to be trying to do, and so needed, having been working in healthcare myself for so long. It's time for change. So how do you think things are going? I mean, it's like, a major effort to try to build that. How is it going?
Things are going incredibly well, knock on wood. We're continually paranoid. And so we're constantly obsessing about all the details that we need to be obsessing about all the time in order to make sure that we really continually do our best in each task we need to deliver on behalf of our physician partners and our members. But the results in terms of member happiness, in terms of care outcomes, in terms of growth have been spectacular.
People don't usually relate like that to their source of insurance, right?
Yes, indeed. Yeah, we have a very special relationship with our members and a very special relationship with our physician partners. And we feel so honored and privileged to be in that position.
Yeah. We can't really have a podcast right now without talking about what's going on in the world. Between the pandemic, we've got social unrest in the United States, really in other countries as well. How's that affecting you guys at Devoted? How are you handling it all? And what are you thinking about it?
It's a terrific question. So first of all, with respect to COVID, right? Our member base is seniors, many of whom are chronically ill, right? So they are the most vulnerable to COVID-19. We have mobilized at maximum power to protect each and every one of our members from the ravages of COVID-19. And kind of the way we talk about it is form a protective shield around each member and seek to prevent every conceivable avoidable death, right, from COVID-19, each and every one. And the way that we really turn that into action, right, is texted, emailed, and then physically called every single one of our members with the support of webinars and other educational efforts to basically make sure they were staying safe at home and to understand what they needed to be safe at home, and helping them each of our members actually get food delivered to the home, medications delivered to the home, et cetera. Connecting members with telemedical offerings from our primary care partners, and just doing everything we possibly can to make sure our members are safe during this crisis. And that's led to an even deeper bond between us and our members. Like we've been, when we call our members, like seniors have been breaking down in tears because we're calling, right? Seniors who say, I have no family left. You're my family now. Thank you for calling me, right? And making sure that I'm safe and making sure that I'm fed.
You're giving me chills. I'm getting goosebumps. It's very touching.
So we really have mobilized to be everything that we should be, and our members need for us to be during this crisis. And it's even more important to be there for each of our members, right? And for our partners, and for each other in this moment that combines a pandemic with massive economic dislocation, right? And tragedy with George Floyd and Ahmaud Arbery and our Black brothers and sisters who have been horrifically taken away from us. And so, we are incredibly proud to be a deeply diverse company that is united by a spirit of love for everyone, and that seeks to help advance the ideal that every American should care for every other American like family. And we see our mission really at the core as bringing more love into the world. And love is the only force powerful enough to overcome all injustice and all trauma, and it can be powerful enough to do so. And we are very, very, very passionate about being part of that in the world.
Yeah. Wow. I mean, that's incredibly inspiring. And in some ways, I think even at Village, this happening, which is so terrible, the pandemic I'm speaking of, has forced us to do certain things in outreach and reaching out to our patients and things like that, and cause new pathways for that, we kind of feel like we really want to continue doing. It's forced us to do things in a different way in some ways that are actually good. But certainly has been a challenge just to make sure that, we're reaching everyone. And it sounds like that's the way that you guys are thinking about it too.
Yes.
I wanted to ask you, I've heard you talk about your time at HHS and working with the Obama administration. How would you describe, where we are in terms of being able to have that data from whether it's government data or from plans? And where do you see it going? Like, where do you think we are in that journey?
Yeah, I think I'm very, very proud of the progress that HHS and CMS and other entities over the years have made on data liberación, right? And making more and more and more data available for use by the public, use by innovators, researchers, entrepreneurs, to improve the health and healthcare of the country. I still think we're in the relatively early innings of it, however. And so I think it's very important to just continue that work and make data more and more available and more accessible in privacy protected ways, of course, at every level, to advance health and well-being and healthcare. And I think it's both at the level of more aggregate data and institutional level data, but also at the level of individual patient data, right? I mean, it's still way too hard for a patient to basically get all of their data from all the places it is. And it's their data, right? They should have a right to their own data, and be able to actually amalgamate that and then make that available to the people that are caring for them, right? So
it's like you have to have a personal assistant with a big bag just carrying it around for you. It's still very hard.
Yeah. And the processes to request it are incredibly cumbersome, right? And so getting it's all too cumbersome, and amalgamating it is all too cumbersome. And that's just not the way we should be rolling as a country. I think continue to focus on how we actually, in particular on that problem, resolve that problem, that each American can fluidly and easily get access to all of their own data, and amalgamate it and make it available to the people that they want to make it available to, who are, for example, caring for that American. I think that's a place where we have made a lot of progress, but have much more to go. And so it's important to stay focused on that and keep at it.
I think you're right. And I think, the funny thing, it might be funny for me to say this is legal and compliance, but, we agree, everyone agrees that it should be private, but I think privacy can be used sometimes as a sword and a shield here, and it like as a stopper of innovation where, the bottom line of the privacy rules is that exactly what you said, people should be able to control their data to be used how they want. It doesn't mean that it shouldn't be able to be used in amazing, great ways, as long as that's what they want. And
Yeah.
you hear that, bubbling around, people opposing some of these new changes that we've just seen some new changes this year to the ability to share it and some of the standards for that. So I agree with you. I think we've got miles to go here.
Yeah. So there is no good argument against the point that a patient should be able to get access to her own data. That's incontrovertible.
When I started my practice, that was debatable whether the patient had we've come a long way. When we're talking about HIPAA, I call that the green light hall pass. Is if the patient wants it, that is what we will do.
Yes. Amen.
Yeah. So I hope to see, we're lawyers and in compliance in my area. Even lawyers are the last to change, and we're learning how to work with data. Obviously, medicine is way ahead of law here, but we hope to see a lot more and think that, as you do, that there's miles to go. What other changes are you hoping to see come through healthcare, in addition to some of the data elements, but other ways that you see healthcare changing?
I'm incredibly excited about the accelerating mega trend in America toward value-based payment and care, a movement that is being led by VillageMD and Devoted and many others, a movement that's been a long time in coming. It's something that America has always known it needed to do, that everyone in healthcare has always known we need to do, to move from fee-for-service and pay-for-volume to true pay-for-value and support enable value-based care. And it just has massive import for the country, because in a value-based payment and care regime, right, patients get the right care in the right place at the right time in a consistent, coordinated way. And that dramatically improves outcomes and keeps people healthier. And in the process of doing so, lowers costs, right? Because someone with diabetes and congestive heart failure got the right preventive care up front, and that kept them healthier and prevented them from going repeatedly to the hospital, right?
Yeah, I agree. In the work of the day, as we're trying to build these models, it's hard, and this, manual, and you do lose sight of that. It's safer, it's better, it's more satisfying. It's so many things beyond just value.
Absolutely. It is encoded in that value, right? Dramatically better care and a better care experience for patients, which as one of the outcomes also lowers cost, because people are taken care of right up front, right? And then don't get complications and don't go to the hospital, right? Because they are in fact healthier.
Yeah, so true. So true. How do you keep pushing? What helps you keep pushing? Being an innovator, it means you take risks. It means sometimes things don't work out. It means people constantly try to fold you back over and over again, back to the status quo, just part of even the little things I've done in my career that are different. People are constantly telling you it's not going to work. How do you push through?
So one of the qualities that I value the most in teammates and partners is persistence.
Yeah.
The inability to give up. And I was asked once to describe life as an entrepreneur. My brother and I were asked to describe it, and we both looked at each other and knew exactly what to say, which was, you get up in the morning and you expect to get punched in the face really hard, right? And if you don't get punched in the face, you say, well, that was a reasonably good day, right? If you do get punched in the face, you say, okay, this is a gift. So we can learn why we got punched in the face so we don't get punched in the same way tomorrow, right?
So true.
And I think that basically, persistence is so important when trying to make meaningful change happen. And what I've discovered is that the teams that are the most persistent are the teams that are not motivated by money. They're not motivated by fame or other similarly empty things, right? About the 40th time those guys get punched in the face, they say, you know what? I'm going to go do something else. The people who are the most persistent are the ones who keep getting up after they've been knocked down, because they cannot stand the idea of the world not having what they're building.
Yeah.
They're fundamentally motivated by the mission.
I've had to say to people, even on my little team, like, guys, this is how change feels. If it was just going to be like a parade with balloons and things, somebody would have done it already.
Yes. That's right. The most meaningful change in the world is always hard, but is what we should all be dedicating ourselves to, right? Because life is short, right? Work on something truly meaningful that you truly love building with people that you love.
Yeah.
And that's what I feel, to answer your earlier question, I'm doing with Devoted in partnership with amazing organizations like Village MD, right? I'm working on a mission that I'm deeply passionate about, that means a lot to me, with people I love, right? Building a new kind of healthcare system that I love. and that to me is the recipe for not just persisting, right? But also leading a truly meaningful and fulfilling professional life.
It's just so inspiring. I want to have you back every day just to feel better. But our last question, we're trying to, especially during these times, we're trying to end on a hopeful note, although so much of what you said is inspiring and hopeful. But how do you restore your hope? What brings you hope and how do you bring hope to your team during these times?
So we have a internal channel on Slack where we post stories about the work that we do for our members, and stories about our members and their lives. And they are so deeply inspiring to me. And those stories really are the visceral reason I get up in the morning and go to sleep at night, incredibly excited to get up the next morning, because the change that we and our partners like Village MD are making in the lives of seniors who built this country, in particular in moments of enormous vulnerability and need for them, I can't find the words to express how deeply grateful I am for the opportunity to do that kind of work, and how inspiring our members are to us as we learn more about them and as we help them persist through their challenges and help them live lives filled with more joy and more well-being and more love.
Todd, thank you so much for joining us on Working Smarter today. You've absolutely filled us all with hope and inspiration. And thank you for the work that you and Devoted are doing. As I said at the beginning, we're big fans, and we hope to have you back sometime in the future to give us an update.
Thank you so much. And thank you so much for everything that you and the Village MD team are doing. We're massive fans of all of you. You are truly treasured partners, sisters and brothers to us. God bless you and all that you continue to do.
Thank you to our sponsor, Village MD. We hope you will join us for future concise compliance conversations.